Welcome to Things You Don't Know. In this episode, in a new series called Secretions, we are going to delve into the fascinating world of pus. Understanding pus, a crucial component of our body's immune response, can empower us to take better care of our health. In this series, we will explore a wide range of secretions from blood to semen, shedding light on their historical ideas, physical importance, and psychological ideas in a scientific yet casual manner. A brief word before we start. I just really wanted to express my gratitude to Dr. Jonathan Mercantini, who is the Assistant Academic and Provost Dean at Kean University, for his encouragement to Dr. Deneen to do this series. When I came up with some of these topics, I really wasn't certain how they might be received. So Dr. Mercantini's support means a lot to me personally. I also want to answer a question as to why are we doing this series? It really comes down to the idea that science can be fun. Looking at everyday things critically is also fun. Hopefully, we can encourage other people to look at many different, perhaps everyday things, perhaps not everyday things, and possibly advance the general understanding of many people. Now, why is that important? Well, basically, I really believe that if people will try, they can make a difference. One person can make a difference. So thank you, Dr. Mercantini.
I wish to echo Dr. Weaver's sentiments and also add my appreciation to Dr. Mercantini. It's always a good thing when the people you work with and for, while having high expectations, encourage and help to bring out your best self. So let's get started by defining just what pus is. Pus is a thick fluid substance that is typically colored yellowish or greenish. It forms as a result of the body's immune response to infection. The composition of pus includes white blood cells, which are called leukocytes, neutrophils, which are primarily white blood cells that respond quickly to infection. These cells are essential in fighting off bacteria and other pathogens through phagocytosis, where they engulf and destroy the invading microbes. Dead cells are also present, dead and dying white blood cells that have fulfilled their vital role in the immune response. Dead tissue cells from the infected or inflamed area. Bacteria, both live and dead bacteria, are the pathogens that cause the infection in the first place. The type of bacteria present in the body can influence the color and the consistency of the pus. Protein-rich fluid, a mix of proteins, including enzymes, released by neutrophils.
Okay, start with that sentence so I don't have to grind my teeth.
A mix of proteins, including enzymes released by neutrophils, help break down the bacteria and damaged tissue. This fluid helps dilute toxins and provide a medium for the immune cells to move through. Fragments of cellular debris result from the destruction of bacteria and body cells. These include broken down cellular components such as membranes and organelles. Lipids from destroyed cell membranes contributing to the consistency of the pus, and electrolytes, various ions such as sodium and chloride, which are present in the fluid part of the pus.
Now that we've explored the components of pus, let's dive into the intriguing process of its formation. Pus formation is a fascinating and intricate part of the body's immune response to infection. It involves a dynamic interplay of various elements, including the swift response of neutrophils, the process of phagocytosis, and the accumulation of dead cells and bacteria. Here's a detailed breakdown of how this captivating process unfolds. The body's immune system is activated when an infection occurs, typically caused by bacteria, fungi, or other pathogens. The first line of defense includes physical barriers like the skin and mucous membranes. When these barriers are breached, the immune system responds.
Bum, 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 bum. Neutrophils to the rescue. Neutrophils. They're a type of white blood cell, as Dr. Deneen mentioned, and they are among the first responders to an infection site. Yes, things get mobilized quick. Okay, these cells are attracted to the site of infection by chemical signals released by the infected tissue and other immune cells. This process is known as chemotaxis. Now, once the neutrophils arrive at the infection site, they engage in a process called phagocytosis. This is the process by which neutrophils engulf and digest invading pathogens. Let's look at the steps of phagocytosis. It's kind of interesting, really. What happens is first, there's a recognition. The signal goes out. The army comes in. The neutrophils attach. They recognize foreign particles through receptors on their surface. They engulf. Now, what does that mean? The neutrophils' membranes extend around the pathogen, engulfing it in a pocket called a phagosome. Now, the phagosome fuses with lysomes, which contain digestive enzymes. Okay, digestive enzymes. So it's eating it, right? Right. These enzymes break down the pathogen into smaller, harmless components, which then macrophage cells can carry away. Wonderful. So now, as the neutrophils digest bacteria and other pathogens, they also sustain damage and die. The accumulation of dead neutrophils, along with digested bacterial remnants, remember I just talked about that, it forms the core components of pus. The army is winning, folks. It's winning. So the components of pus, dead neutrophils that have completed their role in phagocytosis and have died in the process. Dead and digested bacteria, remnants of pathogens that have been broken down by neutrophils, cell debris, fragments of tissue cells that were damaged during the infection, proteins and enzymes released by the neutrophils and other immune cells, which help in breaking down the pathogen and the damaged tissues. It is an amazingly orchestrated, almost an army operation. It really is kind of exciting.
It certainly sounds exciting. Pus comes in different colors due to different composition causes. Typical color of pus is yellow and white due to the accumulation of the neutrophils and dead cells. Green pus can be caused by the presence of myeloperoxidase, an enzyme produced by neutrophils or certain bacteria. A red and pink color indicates the presence of blood in the pus, and brown pus may suggest a long-standing infection or the presence of dead tissue. The exact composition of pus can vary depending on the type and severity of the infection, as well as the specific pathogens involved. The presence of pus is a sign that the body is actively fighting an infection, and its composition provides clues about the underlying cause, as well as about the body's response to the infection.
Now, as we've seen, pus has a significant part to play in fighting infection. As white blood cells attack and destroy the bacteria, many of these cells die in the process. The accumulation of dead white blood cells, bacteria, and tissue forms pus. Pus helps to localize and contain the infection. By accumulating in a confined area, pus helps prevent the infection spread to other parts of the body. The presence of pus indicates that the body is working to remove the debris of dead cells and bacteria from the site of infection. This is part of the healing process. Yay!
I know that your favorite thing, Bunny, is animals, other
Right,
animals. So, does this same process work with animals as it does with humans?
absolutely.
Absolutely.
It works exactly the same.
Yeah. So, it's important for us to know something about this stuff.
Absolutely. If we're going to take care of our animals properly, we need to understand it.
Okay. So, what are some signs that pus indicates a serious problem? Well, the first one is a high fever, which suggests the infection may spread, and the body is mounting a systemic response. So, in other words, your temperature in your body raises in an attempt to kind of cook the infection. Usually doesn't work out that great, but sometimes it does. Severe pain is another indication. Increasing or severe pain at the site of the pus indicates a potentially worsening infection or abscess. Redness and swelling. Extensive redness, swelling, and warmth around the affected area suggest inflammation and infection spreading to surrounding tissues. Streaks of redness. Now, if you look at it, and it has these little streaks, red streaks, extending from the area of the infection toward the heart. That is a sign of lymphofagitis, indicating that the infection is spreading through the lymphatic system. Not a good thing. Swollen lymph nodes can be part of that. Lymph nodes near the site of the infection may become swollen and tender as they work to filter out the infection. Stench. That can be a real strong indicator. Pus that has a strong foul odor can indicate the presence of certain types of bacteria that produce gas or toxins, suggesting a more severe infection. General malaise, feeling unusually tired, weak, or unwell, alongside the presence of pus, can indicate a systemic infection. Again, not a good thing. Okay, difficulty moving the affected area, limited movement, or severe pain when trying to move the affected area can suggest deep tissue involvement or abscess formation. Look, if you observe any of the above signs and symptoms, it is important to seek medical attention promptly. Medical evaluation is necessary if the pus is associated with a large wound, deep cut, or bite, especially from an animal or human. Human bites are among the worst bites you can get, by the way. More dangerous than a dog bite, more dangerous than a cat bite. There's a few that surpass human bites, but not that many. If the wound or infection does not improve despite basic home treatment, you really should go to the doctor, a healthcare professional, not some dipsy doodle on the sidewalk or something, and not some, you know, person who's not a medical healthcare professional should assess that situation. Early prevention is really, really important because it can prevent the spread of infection and lead to more effective and less painful treatment outcomes.
And if you have an animal that's hurt, you need to contact your vet because most times it's a real significant thing that can't be treated by yourself.
There's some lack of awareness as to when pus should be drained. When there's a presence of an abscess, and the signs of an abscess can include a localized, swollen, painful lump that may be warm to the touch and can sometimes feel flocculent, which is filled with fluid. And if the abscess does not resolve on its own or continues to enlarge, despite home care measures such as warm compresses. Fever, chills, and general malaise indicate a possibly severe systematic spreading infection. Worsening pain and swelling at the site of the infection is an indication that professional drainage and treatment may need to be performed. There can be complications, spread of infection, as Dr. Weaver said, signs that the infection is spreading beyond the abscess, such as red streaks on the skin, lymph node swelling, or severe pain. People with other medical conditions, individuals with diabetes, compromised immune system, or other conditions that complicate healing and infection control. The location and size of the area is a problem. Abscesses in areas like the face, neck, or groin can be difficult to treat because complications can be more serious. Larger abscesses are less likely to resolve without intervention and may need drainage.
So, how should pus be drained? Very important. You need to have a medical assessment by consulting a healthcare professional. Always seek professional medical advice before attempting to drain an abscess. Based on the location, size, and severity of the infection, a healthcare provider can determine the appropriate course of action. You need to be using a sterile technique. That's to prevent infection. Use sterile equipment, maintain a clean environment to prevent introducing additional bacteria to the site, and get a professional to do the drainage because you don't want to make a mistake and cause more problems. Incision and drainage, I&D, performed by a healthcare provider in a sterile setting, involves using a local anesthesia. The area around the abscess is numbed with a local anesthetic. Incision, a small incision is made to allow the pus to drain out. And drain placement. Sometimes a small drain or packing material is placed inside the abscess cavity to keep it open and ensure that all pus is drained. Then you have to clean in the dressing of the wound. The site is cleaned thoroughly and a sterile dressing is applied to protect the area and absorb any remaining drainage. Post-drainage care. Well, you got to follow up with your appointments to your health professional, scheduled to monitor healing and ensure the infection is resolving. Wound care. Instructions on how to care for the wound at home, including keeping it clean and changing dressings, are recommended. And sometimes antibiotics may be prescribed to treat any remaining infection or prevent secondary infections. Now, home care for minor abscesses. For small, uncomplicated abscesses, home care may sometimes be sufficient, but this should be done with caution and ideally under the guidance of a healthcare provider. You start out with warm compresses. You apply heat using a warm compress, such as a clean cloth soaked in warm water, on the abscess for 20 minutes, several times a day, to help bring the pus to the surface and promote drainage. Avoid squeezing. Do not squeeze. Squeezing an abscess can push the infection deeper into the tissues and spread bacteria. Hygiene, very important. Keep the area clean. Make sure you wash your hands thoroughly before and after touching the abscess. Protect the area. Cover it with a clean, sterile bandage to prevent contamination. And the same applies to our pets out there. My cat recently had a eye infection, and that's what I did until I got over to the vet, and she said, "Oh, you did it right." And I was very pleased that I remembered some of my trainings.
Indeed. So when to seek immediate medical attention? Well, if you see a rapid spread, like signs of rapidly spreading infection, such as, dramatically increase and sudden increase in redness, swelling, severe pain, or red streaks, that's a sign you should see somebody like now. Systemic symptoms like high fever, chills, rapid heart rate, confusion, those are possible symptoms. Unresolved abscesses. If the abscess does not drain or improve within a few days of home treatment, yeah, you probably should consult a professional, get some real help.
Let's take a look at historical beliefs and false ideas concerning the role of pus in healing. We just did a very interesting podcast about incorrect medical fallacies. Throughout history, medical understanding of pus has evolved significantly. Early medical practitioners often had misconceptions about pus and its role in healing, most famously Galen Permagon, a prominent Greek physician in the 2nd century AD. He greatly influenced medical thought for many centuries. Galen believed, absolutely incorrectly, that the presence of pus in the wound was a positive sign indicative of the body's natural healing process. He termed this laudable pus and considered it an essential component of healing wounds. According to Galen and his followers, the formation of pus was seen as the body expelling harmful substances and purifying the wound site.
Oh, brother. Yeah, another ancient medicine theory prevalent in Greek and Roman understanding was the humoral theory. What this is, the theory posited that the body contained four humors: blood, phlegm, black bile, and yellow bile. um, Pus was associated with an imbalance of these humors, particularly phlegm and yellow bile. The production of pus was seen as an attempt to restore balance by expelling excessive humors from the body.
Now, the idea of laudable pus persisted into the Renaissance, with many surgeons and physicians continuing to believe that pus was beneficial for healing. Wound treatment, sometimes surgeons intentionally introduce pus formation by applying irritating substances to wounds, believing this would promote better healing. Wrong, wrong, wrong.
How unfortunate. Andreas Vesalius and Ambrose Paré, pioneers of anatomical study and surgery in the 16th century, began challenging some of the older beliefs. While they did not completely overturn the idea of laudable pus, they laid the groundwork for a more scientific approach to medicine.
The development of germ theory in the 19th century by scientists like Louis Pasteur and Robert Koch revolutionized the understanding of infection and disease. Germ theory revealed that pus was a sign of bacterial infection rather than a necessary part of the healing process. This challenged the long-held belief in the benefits of laudable pus.
Joseph Lister, a British surgeon, applied germ theory to surgical practice. He introduced antiseptic techniques, despite being almost labeled insane, to prevent infection, significantly reducing post-surgical mortality. Lister's work demonstrated that pus was not a positive sign, but rather an indication of infection that needed to be controlled. This marked a significant shift in medical practice and in understanding.
Some of the false ideas concerning pus persisted for many years, and the relics of some of those ideas influence many people's thoughts to this day. Some of these ideas are the belief that pus was essential for healing, which led to harmful practices such as intentionally irritating wounds to promote pus formation. Today, we know that pus indicates an ongoing infection and that preventing and controlling infections leads to better healing outcomes. The idea that pus purified the body by expelling toxins and harmful substances, well, that one persisted for centuries. Is just not accurate. Modern medicine rejects this notion, understanding that pus is a byproduct of the immune response to infection rather than a cleansing agent.
Now, today there's a fascination with popping pimples and pus extraction from abscesses, as evidenced by the popularity of videos such as Dr. Pimple and others. Caution should be exercised in using any of the techniques used in these videos as scarring and spreading infections, especially when the pus is more liquid, and various physical problems. You might think because you have popped pimples without problems that it is safe, but that is like saying you can walk across the street wearing a blindfold without getting run over because you did it once. To continue this analogy, you cannot know if you are crossing a street or an interstate highway.
Very well said. So, what are the reasons for the popularity of these kind of videos?
Well, the popularity of pimple popping videos can be attributed to a combination of psychological satisfaction, curiosity, stress relief, emotional value, social aspects, and visual appeal. And also the viral nature of internet content. What do I mean? Well, many people find satisfaction in seeing a pimple being popped. It may provide a sense of relief or completion, like, okay, this can all be taken care of by a simple squeeze. Um, there's also something called the ASMR effect, which is the uh, autonomous sensory meridian response, which the sounds and visuals of that kind of thing can really trigger, and it creates kind of a tingling sensation that many find relaxing and pleasurable.
There's a natural curiosity about bodily processes and transformations, and pimple popping falls in this category. The combination of disgust and fascination can be compelling. People are often drawn to things that are gross yet interesting.
The shareability and shock value of pimple popping videos contributes to their viral nature, making them very popular content on social media platforms. Social media algorithms then often promote these videos due to their high engagement rates, further increasing their popularity.
Ah, boy, we could go on and on, as many intricacies could be explored. However, I think it is time to bring this episode to a close. Look, we do really thank you for joining us. Hope you enjoyed this podcast. Uh, Please don't follow the maxim of just a little squeeze, put your mind at ease. Don't do it. If you did like this video, this podcast, please give us a like. Do it now while you're thinking about it, okay? And subscribe or make comments. But for now, I bid you adieu.
Goodbye for now, folks.
Many wonderful things coming up. Looking forward to being with you. So until next time, so long, everybody.